So, apparently, unannounced to me, bipolar disorder is a progressive, disease in the sense that if it's not treated or controlled, it gets worse. Like, severely worse. Yes, bitch. It can get worse than it already is. What's going on, YouTube people? Thanks so much for tuning back into another series of Medical Madness, which I guess we're doing again. I mean, we've never really stopped, but there's definitely been some pauses in there. As I said a few weeks ago, I was thinking about getting back on medication for bipolar disorder because, well, like, life's a mess. That, and I really need to take my Adderall, and I would rather not be hospitalized because I fused Mania and Adderall together, I feel like I've definitely talked about bipolar disorder being a progressive disease before. It didn't click in my mind. What I mean by that essentially is that bipolar disorder, when it develops, it typically starts with an episode. And if you don't stop the next episode, or if you don't, go into treatment and do some preventative work, which is all the things we talk about on this channel, or don't talk about. Well, we talk about it, it's either me doing it or me saying how I don't want to do it. If you don't control it, or if you don't control the rate at which you're having episodes, they can start to happen more frequently, and even worse, they can start to happen just because. I mean, it already feels like they just happen because, but it's not gonna take like necessarily a trigger. So for me, it doesn't have to be like, the triggers in the past have been people like dying or like some crazy ass shit. Or another trigger could be, you're just moving homes. Something like that. It doesn't have to be those are big life events, but you know what I'm saying. Briefly, if you're new to this channel, I thought I would just go through some of my bipolar history with y'all, just so y'all can sort of see where I've started from and now where I am, / I have a whole bunch of videos on them, so if you really want to know the details, go check those out. So I was diagnosed with bipolar disorder in 2018. It's been that long now. And, we're still dealing with this. Not that 3 years is really that long for this type of, illness. But people have been telling us all of these different things, like, don't do this, and expect this, and expect this. And we've been like, yeah, sure, whatever. And now look at us. When I was first diagnosed, I started off with Tegretol, which sucked ass. For me, personally. Side effects sucked, and that's kind of like a theme of sort of my pharmacology when it comes to dealing and treating my bipolar disorder. The next one I tried was Abilify, which was fine, I guess. No, it wasn't. So I tried Tegretol and Abilify, and while I was supposed to try lithium at first, lithium was like the third and the last one I have ever tried, and lithium worked really well for me, to be honest, except for the side effects. Once again, it made me super nauseous, and vomiting was a whole thing. And I have not been on any medication in the past year or since. It's been almost exactly a year since I stopped. So I'd like y'all to meet Depakote. Depakote is an anticonvulsant, so it's similar to Tegretol in that way. Not like chemically similar, but like, I guess in that classification of types of medications. At first was a little bit nervous because I was like, I don't want to take that if it's anything like Tegretol, but it's not. In the realm of, treating bipolar disorders, Depakote and Tegretol are typically used to treat manic or high elevated symptoms in people, whereas I believe it's limictical. That one, limictical. I keep on saying that. Say malictal, or malictical, whatever. But that one's typically used to treat the lower sides of depression. So if you have like bipolar 2 or like some other there's tons of different bipolars, and you can even just have bipolar disorder unspecified, I guess, and it can be whatever the freak. It's very special to you. So Depakote being treated for mania, it's exactly what I needed because not surprisingly, I haven't had a lot of psychosis this year, which is good. I have definitely had some, but I actually pulled one of my medical files from when I was first diagnosed, and I was reading through it and just kind of revisiting that time of my life, just revisiting. And I haven't really had psychosis this year. I haven't heard like voices or auditory hallucinations or any of that stuff. In the file, I remember saying that I completely forgot about this. It sounds like batshit crazy, but we're not batshit crazy. We're just struggling in different ways. But I referred to them as like Julius 1 and Julius 2, and there were these two different voices, and it got like real intricate, and I was just like, whoa. We have not experienced anything like that this time, but we have experienced, you know, all the other problems like cognition and memory loss and that stuff which we actually need for life. One of the cool things I learned about Depakote is that, you know, it does have various side effects, and while it's not lithium, and lithium being like the front line that's used, Depakote's side effects don't seem to be like that bad unless you have like a pre-existing condition with like your liver or your kidneys or whatever already, or if you're a pregnant woman. I don't believe that they can take it. I didn't do a whole lot into that because I'm not a woman. But if you are experiencing side effects, or if I do begin to experience side effects myself, which I haven't, I've been on it for about a week now. Let's say it's like 7 days. So it's not working because it needs time to build up in your system. It'll probably start working in like a month, to be honest. So not great on that front, but once it does work, it's like very stable, very powerful in its ability to work, I guess, if that makes sense. It just takes some time. What I was saying about side effects, though, is that if you are experiencing side effects, or if I am experiencing side effects, apparently that as you take it more and more, those side effects should lessen in your body. So you just kind of have to stick it through, and it sucks in the beginning. I haven't had that with any other type of medications except for Lexapro, which I think actually ended up just making me manic. I'm not sure because I didn't know I was bipolar at the time. First started taking it, I had the worst anxiety that I had experienced up until that point. Like, that's nothing now, like, compared to this shit, like, recently. But I had the worst anxiety ever, and I was like, what is this? And then it went away, and then, like, it literally felt like the clouds came apart and the sun came out, and I was like, oh, shit's awesome. And it was great. Yeah, stick it out if you are taking it, and try, unless it gets super serious. Like, you know your body, you can kind of tell, you know, what's, like, I can work through this, and like, I need to go to the hospital, like, I can't do this, fuck this shit. Furthermore, I found that it's actually the only FDA approved drug for bipolar disorder, or like for bipolar disorder, for mania within bipolar disorder, which is pretty freaking cool, I think. Not that the FDA really matters. It's FDA approved for bipolar mania, which I think is pretty cool. So maybe that kind of gives me some hope, that in the sense that it's actually gonna target my mania and kind of bring me down, but not too far down that I'm like either feeling like a zombie or I'm like depressed. With that though, it's been, from what I've understood about it, is that Depakote really, I'm just taking it by itself. I think my doctor, because I haven't really had any psychosis, maybe I don't need an antipsychotic to pair it, like to pair to Depakote with it. But from my understanding, Depakote works better when it's, you know, working with another drug. So like maybe lithium in Depakote, or something else, I guess. I'm not a doctor, so like I honestly don't know what Depakote could be with, but essentially it's very specific to mania. And bipolar disorder can have a lot of different other things in there, like, you know, I could be depressed, or I could be having hallucinations, or I don't know, anything else. So yeah, it's specific for mania, so it helps with mania, but it's also like enhanced. You can enhance it, or it works even better when it's paired with another drug to work in combination with that, if that makes sense. So it says, I don't know how to pronounce this. It's Divaprolex. It's Depakote. It says extended release. I guess that's what ER means. I don't know if there's Depakote instant release. Oh, I'm wondering what that's like. But it's extended release. It's 250 milligrams, and I take 1 tablet a day for 7 days, and then as I go up on it, I take 2 tablets from there, and then I'm gonna meet with my doctor. So next week I'm gonna start 2 tablets this week. Next week I'll meet with my doctor, and we'll go from there. From my additional understanding, you know, that's a very, very, very low dosage, and it might even be below therapeutic levels, so I might be going a lot further up on it. But, you know, in order for the body to get used to it, and for it to like work, and for you not to shock the shit out of it, and possibly, I don't know, I'm not sure what happens if you just start taking a full dosage of it. You have to go up in that way. Same thing with coming down, you know, when you stop the medication, you're not really supposed to stop these medications, just stop cold turkey. You're supposed to come down on them. It's safer that way. Essentially though, it works kind of in the same way as Tegretol, or any other anticonvulsant prescribed for bipolar disorder, if you've seen my other videos. But again, not a science person, so like, correct me if I'm wrong. If you don't understand what I'm saying, let me know, because the explanations are rough. But it makes the nerve endings, or the nerves within our brain, I guess, or within our bodies. I'm not really sure. Nerves are throughout our bodies, yeah. It makes the nerve endings less excitable, which is kind of what makes us more elevated. So it calms them down, for the lack of a better word or phrase. So in calming like these nerve cells, it's restoring the balance that we, as bipolar people or people diagnosed with bipolar disorder, or living with bipolar disorder, however you want to say it. As somebody living with bipolar disorder, it helps balance those neurotransmitters out. Because as of right now, I guess I have more of the happy ones, or it focuses on GABA, and there's like a whole bunch of different GABAs, but GABA's just how I understand it as being just GABA. So it focuses on balancing that out, because I guess I have more of it, or whatever the deal is. Think of it like a scale. Bipolar disorder, the reason why we go like so high up and so far down instead of just a little bit up and a little bit down like normal people, is because we have a lot more of those chemicals being pumped into wherever they go, or the signals are going. There's a lot. It's not even. So it works to balance them. Adding to that, and just sort of adding to the idea that Depakote is really best used when it's paired with another type of drug that you may need. I'm not really sure what that would be in my case. My doctor says we're going to revisit Adderall again. That's not the pairing I think that they mean, but because I have ADHD as well, seeing how we can tame my mania and then work on my cognition problems. So we're gonna revisit that. But in that realm of conversation, I was reading, and a research journal was talking about how bipolar disorder doesn't really have a universal, like one size fits all type of behavioral. I forgot what they called it. They said behavioral domains. They said that, whatever that is. Don't take my word for it 100%. Let me like check on that, and I'll put it right here. The only real, I guess, universal behavioral domain, you could say, is just impulsivity, or the lack of thinking, or what do you call it? Judgment. The lack of judgment, or like the impulsivity that comes with bipolar disorder. We're all very impulsive. To what degree that looks like, or to impulsive in what, varies. I guess you can have all of the different behavioral domains, but what I can confirm from this journal is that it was talking about that Depakote, nor does like any other bipolar drug, like fix all of those behavioral domains. So I think that actually we all have them, or we all operate within them at some point, depending on when our lives are, when the episode is, what we're doing, blah, blah, blah. But there's no drug that's gonna like fix all of those. So like Depakote, as I was saying, works on mania. It does not work really for depression. And you might need that, because I do get depressed, and I have been depressed. That shit sucks. I'm just not depressed right now. Or, what if Depakote brings me down too far and I do get depressed? We need something to pair with it to kind of keep me from being depressed. Often that's like why people get off medication. It's either like fucking them up, like in my case. I mean, there's tons of different reasons, but a large one is that, if I'm taking Depakote and it makes me depressed, or it brings me so far down that like life is just boring and gross and now, like, I'm just not feeling it, then that's not helping me wanting to take, because I know the medication is the one that's doing that, so I'll just stop it, which then we'll be right back to where we started. Instead of thinking like, okay, I take Depakote and I take maybe lithium, and that pair together, lithium keeps me from being depressed, and Depakote keeps me from being too high. I just like pulled out 2 random drugs. I'm not sure if that's actually true, like, they might do. I don't know about the actual science behind it, but hopefully that makes sense. The thing to take away is that just not one drug to fix all of the behavioral domains, which people were questioning or wondering why I was on so many medications at first when I first started, and I was on like a whole bunch of medications that I personally, for me, don't think I needed to be on. But that doesn't necessarily mean that that's the case for everybody, because you're taking medications that sometimes interact with each other, not like in the bad way, but like that are acting on each other, as I just described. So I guess in my case, Adderall, I do have ADHD, and I do need Adderall, and I've tried other stimulants, I've tried other non-stimulants. Adderall works the best for me, but I definitely will become manic, like if I'm not on something that stabilizes my mood. So we have to figure the mania out first. But when I took when I took lithium and Adderall, like those two worked very well together except for the side effects. And that's kind of, I guess, an example of pairing them together and working that way. So yeah, that's Depakote. I know I didn't go into like extreme detail. Again, I'm just gonna take some time to work. Can't really give any personal details about my experience, but these are my thoughts, you know, going into the medication. I really wanted to know, okay, how is this medication working? Like, what is it actually doing? Because the way lithium works and the way we understand lithium, I didn't like the explanation given to me for me to even be on it, especially with the side effects I was experiencing, because we low-key don't know. We don't know how it works. Doesn't mean that you should stop taking yours. I just personally like to know. And we don't know a lot of things in the world, but it's also like concerning. I feel like we should know more before I take something that could like end me. So I'm definitely nervous. I don't want to be taking this, like I said. I haven't experienced any side effects though, so that's the good thing. I'm just kind of taking it. I'm still kind of elevated. So nothing's really changed in my life per se. I will say that it's made me tired, and I'm not sure if it's just in my mind or if it actually does. It does cause drowsiness, like that's a symptom of it, and it's supposed to make you tired at night, because that's when I take it before bedtime. I honestly don't, I eat dinner or whatever, or I have my meal a day, I guess. But I don't typically take it with anything to eat, and it doesn't make me nauseous, which is great. If it does, you can just take crackers or something, but it seems pretty tolerable. Again, I should say, I'm also on an extremely, extremely, extremely low dosage. So maybe it's just common. But, you know, I'm excited. I'm nervous. I have all these weird mixed feelings that don't make sense, because I'm like, it's like you just pop the pill. It's not that hard. Like, why are you... I don't want to let go of my mania. I'm going to miss it. And just everything with mania is, like, so exciting. Life is just... doesn't matter what it is. So I think that's why I'm afraid to go the opposite way, especially with everything that's going on in my life that I've kind of caused. I've, like, caused... I wouldn't say heartaches, like too extreme. I've caused these problems in my life because I was manic, that I know that if I'm not gonna deal with being manic, if I'm dealing with them sober, I guess you could say, then they're gonna hit me hard. But at the same time, you can't deal with them when you're manic because you can't do anything. So it's like a cycle. You see, we gotta do what we gotta do. And I do remember being there was a very long period of time on lithium and Adderall going. I had a regimen going, and besides vomiting every night or every other night or whatever it was, besides that, I was happy and it was working and it was fab. It was dope. So that's what we're excited about, and we're gonna see. I'll like probably hit y'all back with another video. Probably not next week because it's gonna be like the second week. I'll probably like wait till like third week and see what happens. Because again, I'm sleeping more now, but not fully. I'm like still elevated, like and we'll see. So yeah, we're done here. If you liked this video, please give it a like. If you found anything that you could take away from it, if you were confused on anything, let me know and leave a comment, number one, but leave a like as well. And along those lines of leaving a comment, if you just have any questions, I'm not a doctor, as I said. I'm not a pharmacist. I'm not like anybody really besides, I guess I was a student at one point, and I like learned how to research things and read like journals. So I can do that, and it's not, WebMD does not, or like those generic sites, they just kind of explain that like, oh yeah, there's this and it helps, but they don't explain like, okay, it helps with bipolar disorder, but how does it help with bipolar disorder? Like, how does it actually change the mind, or like, what is it doing to my body? And I like to know that part. Not that it matters, I think, and it's not really explained to us. At least my doctors have never explained to me that way. It's something that I think that we should know if we're putting into our bodies, especially if the warnings are like dire as fuck. Lastly, you know what to do. Subscribe and turn on those subscription notifications so that you can find out when I upload a new video on Depakote. Plus, a new video on the cognition stuff. Plus, I'm struggling with uploading the video about the relationship drama BS because like I'm kind of over it and just want to drop it. But we'll see. All right, y'all. Peace.